You can build an incredible career, master your industry, and understand exactly why your relationships keep failing, yet find yourself powerless to stop the cycle. Insight alone rarely rewrites reflexes. Mapping a history or reframing a thought fails to address the physical response of the body during conflict. Emotionally focused individual therapy, or EFIT, treats relational roles as biological survival strategies installed before the development of language. Narratives and logic form in the prefrontal cortex, but the pain of disconnection fires in the autonomic nervous system, what EFIT calls the first ledger. A cognitive intervention is biologically incompatible with a nervous system wound. The therapy must meet the injury at its own level. In many clinical settings, a client acts as a passive observer of their own history, recounting events to a listening therapist. EFIT moves beyond observation. Human biology relies on others to regulate emotion, so the therapist forms a closed-loop biological circuit with the client. Operating inside the circuit allows the intellectual, rehearsed story of other to lose its utility. The focus moves to the experience of self, the somatic reality present in the client's chest and throat during the session. Healing an attachment wound requires the physical experience of safety. This makes the therapist a temporary attachment figure who provides physiological co-regulation. In EFIT, the therapist's regulated nervous system serves as the biological medicine that the client borrows to stabilize their own. The first ledger is the nervous system's log of every safety and trauma signal received since birth. Warm, responsive inputs from early caregivers register as safe. Inconsistent or absent inputs log as danger. When adult closeness occurs, an unresolved ledger defaults to that danger setting. Stage 1 of EFIT involves diagnosing how this internal system reacts to perceived threats. The RAVE framework maps this process, starting with the hidden core of vulnerability, terror or grief. This triggers Node 2, attachment sensitivity, the biological wound of feeling abandoned. To manage this pain, the system produces Node 3, reactivity, the visible behavioral defense. A client's toxic or distant behavior is a biological response triggered by an invisible vulnerability. We can examine the reactivity phase to see how the nervous system flees from the pain of an attachment wound. Nathanson's compass of shame maps 4 vectors for this escape. Outward vectors include attack self, internalizing blame, and attack other, using cynicism to deflect. Inward vectors are withdraw, going numb, and avoidance, using compulsions like overworking to stay distracted. Clinically, these vectors represent protector parts. These biological flight mechanisms evolve to shield the client from further trauma. A client who stays in these defensive quadrants indefinitely may eventually mistake their biological armor for their identity. Stage 2, restructuring, requires moving past these protector parts to reach the vulnerable core. This demands reflexive participation. The client learns to witness their own nervous system firing without letting a protector hijack the moment. The primary tool for this is the EFIT Tango, a 5-move clinical sequence. Step 1 is mirroring present process. The therapist tracks real-time somatic shifts, a softening voice or posture change, rather than the client's story. Move 2 is affect assembly. The therapist guesses the subsurface emotion driving that physical shift. These moves pull the client out of a rehearsed cognitive script and into their present biological reality. Once the vulnerable emotion is found, EFIT moves away from analysis or immediate soothing. Step 3, heightening, amplifies vulnerable emotion to the therapeutic edge, forging new neural pathways. Move 4 works with protector parts, honoring and bypassing biological defenses. Step 5 is integration, co-regulation where the client experiences their core wound anchored to the therapist's regulated nervous system. Surviving this raw emotional exposure without abandonment adds a powerful new biological data point to the nervous system. Stage 3, consolidation, integrates this new biological data. This achievement functions as time traveling. The present, regulated moment connects with and provides safety to a frozen past trauma. The process creates a missing experience of safety and logs it directly into the biological system. New, heavily weighted co-regulated data points accumulate alongside the original trauma pathways. These new recordings eventually outvote the old trauma signals. Accumulating enough integrated tango moments tips the scale. The system responds to evidence of safety rather than the old recording of danger. Repeating this sequence shifts the nervous system's default state from an anticipation of danger to an expectation of safety. The client eventually internalizes the caring presence of the reliable therapist. The ultimate task of EFIT is for the individual to become a regulated, safe environment for themselves. Only by regulating their own internal system can an individual break defensive cycles and provide safety for a partner.